Good evening, everyone. Welcome to another live. I was hoping I had some time, so I thought I would go and do some more practice questions with you. These are random questions, so there's no real subject or theme here, and they are difficult questions. So these are from Amboss. These are all either 4 or 5 hammer questions, and so they're challenging, but I found them to be pretty fair. So this is going to make you think a little bit, all these questions from tonight, but it's also very similar to what step 1 questions are like now, right? It really makes you think. They're not just verbatim kind of matching, like matching a buzzword to the answer choice. So secondary, tertiary type of questions here. So if you haven't been in this live before, we're gonna go through the vignette together, and I'm gonna analyze it along the way. But I also give you guys a minute to see if you can. There's something on here. Give you a minute to figure out on your own, and you guys can tell me what you think the correct answer should be, and then once you think you have the answer choice, throw it in the chat, and then we're gonna read through it together as well, and then I'll analyze along the way. Okay. So in this patient, I want you to try to figure out what the diagnosis is, or what's the issue, and that's at least something that we can start with. But we'll give it like a few seconds, and then we'll get started and read through the vignette together. So again, a lot of the questions I have tonight are more difficult ones. I found them to be secondary, tertiary level, and they're all going to be 4 or 5 hammer questions out of 5 total. So let me know what you guys think the answer should be. And we're going to go off on a few relevant tangents too. We're going to make sure why the correct answer is correct, and then also address why the incorrect answers are incorrect, and really unpack these vignettes. I realize a lot of students, when we're studying, we're reading the books, the resources and things, but application of questions or question strategies are often lacking, or we don't give it much attention. So a lot of students I've worked with, their main issue is application of the knowledge within questions. Okay. So again, if you think you know the answer, or even if you want to kind of take a wild guess, you're not sure, throw it in the chat, and then we're going to go through it together. Okay. Let me know what you guys think it should be. Okay. Usually the way I like to read questions is I like to read the last sentence first, so I have an idea of where the question is headed. And so, and then I read from the top and go through it and analyze along the way. Now, when I do questions on here on the live, I really kind of read every single word just for practice. And I think that is important and helps with the methodical approach through questions. I know a lot of students, they kind of just like to jump around, find the buzzword, but I'm going to read through it thoroughly, analyze it along the way. It just helps with practice as well. Okay, so let's see. We already got some option choices coming in. Rayan is saying B. Muhammad is saying A. Mahad is thinking E. Muhammad A. Okay, let's see what's going on. We're about to start reading this question together in a second, but throw it in the chat. Let me know what you think the answer should be. Okay, so Sima Roma is thinking A. Karina, welcome. You're saying B. Bain, welcome. You're thinking it's A. Favor, hi. Thinking F. Okay, so let's read through it and see what's going on. Okay, so the last sentence is saying, which of the following is the most likely predisposing factor for this patient's current condition? So what's the predisposing factor for his current condition? So let's figure out what his current condition is first, as like the first tier, and the second tier will be like a factor for it. Adogu, welcome. Good evening. Hi, how are ya? Okay, so what's the current condition and what's the predisposing factor for it? Okay, so a 59-year-old man is brought to the emergency department by his wife because of fever, chills, night sweats, and generalized fatigue for 2 weeks. So is a middle-aged male. He's come to the emergency department, so it seems pretty serious. And he's got fever, chills, night sweats, and generalized fatigue for 2 weeks. It's been going on for a while. All of this makes me think maybe something infection. obviously bothering the patient. His temperature is 102.4, so he's febrile. He appears ill, so looks pretty bad. Physical examination shows a grade 3 out of 6 mid-systolic, 3 out of 6 mid-diastolic murmur at the left sternal border and crackles at both lung bases. So they gave us a lot of information here. There is a diastolic murmur at the left sternal border and crackles at both lung bases. Okay, so you should already be thinking about what are the diastolic murmurs. This is a quick practice as a tangent as well. What are all your diastolic murmurs? Which one could be heard at the left sternal border? And then crackles at both lung bases. This phrase tells you usually that there's fluid in the lungs. And so the issue is either a lung problem or it's the left heart that's messed up and the fluid is backing up. Okay, so I'm, kind of figuring out a few things with just this one phrase here. Okay, so the the diastolic murmurs in general, you guys should be coming to mind with mitral stenosis and aortic regurg, and then the counterpart would be tricuspid stenosis and pulmonic regurg. Okay, so these would be the diastolic, figure out which one would be at the left sternal border just to practice, okay? And crackles. So crackles are telling me it's left-sided, so I'm probably holding on to these two, possibly, right? Mitral stenosis and or aortic regurg, okay? A transesophageal echo shows a 12 millimeter vegetation on the aortic valve. Okay, that kind of gave it away for us without having to do too much thinking. An echo shows vegetations on the aortic valve. So you're like, okay, it's probably aortic regurg. Okay, we're down to that. Blood cultures show gram-positive, catalase negative, gamma hemolytic cocci in chains that are unable to grow in a 6.5% sodium chloride medium. So here's our clue here, okay? Another one at least. So it's gram-positive, catalase negative, gamma hemolytic cocci in chains that are not able to grow in 6.5. They gave us a lot here. Okay, so I'm just gonna practice and really unpack this and take my time a little bit, but gram-positive, cocci, that makes me think either staph or strep. Catalase negative makes me think it's strep, because that's catalase negative. Gamma hemolytic makes me think it's either strep, the enterococci or the non-enterococci. So I'm down to those two. And then it's unable to grow in 6.5. So between those two, I'm down to the non-enterococci. Okay. Do you remember what is the non-enterococcus bug? Okay. So this kind of gives us the reason that he's probably feeling ill. Okay. So I want you to be very careful. Gamma hemolytic brings me down to... All right, so let's break that down again. So it's gram-positive, which is a lot of things, but gram-positive cocci. So cocci makes me think that it is staph or strep, okay? One of these two. That is gram-positive and cocci. Then it's catalase negative. I'm like, okay, it can't be staph because that's catalase positive. Then out of the strep, okay, if we add gamma hemolytic, I'm either down to enterococci or the non-enterococci. The one that does not grow in 6.5% sodium chloride is going to be the non-enterococcus. That's the group, but specifically it's the strep bovis, which is the old name, or strep gallolyticus. Oh, that spelling is off. So that's how we would break down, and this sentence right here is telling me, okay, that they wanted, this sentence right here is helping me figure out what bug it is exactly. I'm down to strep gallolyticus. Now, strep gallolyticus, why is it causing a murmur and, the infection? Murmur plus fever. A murmur plus fever equals endocarditis. And I want you to get in the practice of pulling that out of a vignette. There's a fever and there is a murmur. That usually I want to think of endocarditis first. Putting it all together, okay, the endocarditis from the strep gallolyticus. How did it get there? So first of all, the current condition is that he's got infective endocarditis, okay? And what's the predisposing factor? Endocarditis from strep gallolyticus is usually due to underlying colon cancer. Huge hint. So for those of you guys who are saying B, you'd be absolutely correct. Okay. So Joe Habibi, welcome, right? So colon cancer is correct. Abdul Rahman, bovis, the blood cancer in the colon, absolutely. Favor, so you had it. UI, viridins, strep viridins, that is one of your alpha hemolytic streptococci. So that's why viridins would be out, right, when they said gamma. Okay. Oh, yes, Abdul Rahman. So I mean, I didn't use the clue chains, but that also could have been used. Chains are also strep. Clusters are staph. So, I mean, I didn't really need to use that hint, but good practice. Okay. So awesome. Avantika and Abdul Rahman, right? You said Galileticus and Bovis. So Dr. Inkle and Karina, hopefully you know, right? Viridins would be incorrect based on the, the phrasing they gave us. Awesome. So again, this was a 4-hammer question, pretty difficult because you're supposed to, and again, figure out what's the issue, what's the, the presentation, what's the bug, and then where's that bug usually associated with, like what risk factor. So it's kind of like a, 2 or 3 step process of getting there. Okay. Any questions on that? Can we go through the groups of hemolysis? Sure. Okay, so real quick, okay, I'm gonna write it right here. But when you have strep group, okay, strep can be either alpha hemolytic, beta hemolytic, or gamma hemolytic. Okay. JLKM, I do have these videos recorded. I am in the process of uploading them onto YouTube, so you guys can always refer to that, hopefully. Okay. I love heavy metals. Okay, thank you. You're on the you're explaining it. The hemolysis. We're gonna go over it together too. 4 hammers are valueless. Just hop in UWorld, fellas. I do agree to an extent. I love UWorld, and I think Amboss is really good too. I do say take the 5 hammer and some of the 4 hammer questions with a grain of salt. These are questions I found that I thought were pretty fair when it comes to 4 hammers. Dr. Inkle. Okay, fair enough. Honestly, sometimes you just got to know it for the exam. If you talk to physicians who are practicing or in residency and training, right, they say none of this stuff comes up. And I think it's just kind of funny, right, that there's such a disconnect between what the exam requires us to know versus what practice requires us to know. And so I know a lot of physicians come after me and be like, this is useless. And I'm like, okay, fair. It's useless in practice, but we do need to know it for the exam, right? So I do agree. Thank you, Mahad. So, again, strep can be alpha hemolytic, beta hemolytic, or gamma hemolytic. Alpha means it's partial hemolysis happening. Beta means that there's complete, so it clears it out. And gamma means that there's no hemolysis, none. And there's 2 streps under each category. So partial alpha hemolytic could be either the viridins group or strep pneumonia. Strep pneumoniae, I should say. Under the complete, it could be group A strep. Oops, can't write. Group A strep, which is pyogenes. Or group B strep, which is agalactiae. And then the gamma hemolytic, it could either be enterococci, like we said, or it could be non-enterococci. Now, there's further tests to figure out between these two which one it is, right? Viridins and pneumoniae can be separated by a test. Pyogenes and agalactiae can be separated by a test. And enterococci, non-enterococci is separated by the 6.5% sodium chloride growth. Okay. Right? Dr. Inkle, unless maybe you're going to like pathology or planning to be a pathologist or a microbiologist, but it's a necessary evil. We got to know it for now, at least. Okay. I have a lot more questions actually lined up, but any questions on connecting to this? Oh, Redrum, is this your handwriting? That's awesome. What does hemolysis mean when discussing these bacteria, Adogwu? So this is more like with, when you grow it in an agar or growth in petri dishes, bacteria, some of them have an inherent property to lyse RBCs. Okay, so if there is blood RBCs in the agar and it either breaks it down or doesn't break down the RBCs, it kind of gives you a hint of which bacteria it is. So it's in the realm of helping to diagnostics. Okay, any questions related to this? I mean, there's no point in really going on with the other option choices. I usually do, but just know, there's some endocarditis. I guess we can go over some of them as I'm seeing it. So when they talk about IV drug abuse, what bacteria should come to mind? There's a couple. Oh, you're welcome, Adogwu. Red rum. Okay, that's funny because I don't really see anyone else make those capital R's, and people get really angry that I do that. I don't know. I've been doing it since high school, and writing the lowercase r is just so unnatural to my hands now. But yeah, this is my trying to write quickly. Okay, yes. So IV drug abuse. You want to think of Staph aureus. Okay, this is the acute bacterial endocarditis. Okay. When they talk about valve replacement, do you know the bug that should come to mind? Good. Okay. I look for Staph epidermidis usually first. All right. Careful. It's Staph. I know I'm writing just S, right? But these are Staph aureus and Staph epidermidis, not the strep. Just to be careful. Periodontal disease. Do you know what bacteria they like to talk about with that causing endocarditis? No worries, little olives. Okay, so periodontal disease, they'll talk about like things like dental caries, dental procedures, root canals, possibly. Okay, awesome. This is where you have the strep viridans group. This is causing subacute bacterial endocarditis. Chimonia, yes, says strep mutans is under the viridans group, so that works as well. Okay, awesome. These are just some of the big ones you should know connected to endocarditis. So again, fever and a new murmur. This has been a lifesaver in step 1 and step 2 for me. If I'm able to like be self-aware and be like, ooh, let me pull out the fever and murmur out of the long vignette sometimes, it's usually endocarditis like 8 out of 10 times. You're fine. Okay, awesome. If you guys are step 2 students, you can take it even further and think about things like the Duke's criteria, what's the best confirmatory diagnostic test, the empiric treatment, and prophylactic treatment, okay? And what requires what. So that's going into the realm of management, but those are things that you want to connect with endocarditis. They love endocarditis in step 1 and step 2. Oh, I realized what I did. So what's the answer? Sorry. I just made a lot of chicken scratch. Colon cancer is the correct answer. Okay. All the other ones are wrong. Awesome. Okay, if there's no questions, let's move on to the next one. Okay, you're welcome. The lean Siba. Okay. I have another, I believe it's a 4-hammer question. Let's go to this one. So again, I'll give you a second to figure out or read through it. Let me know what you guys think the answer should be, and then we're going to go through it together and break it down. Okay, if you guys think you know the answer, throw it in the chat. Zoom out. Oh, sorry. Does that help? Oop, I realize it's hard to read the whole thing. Just technical difficulties. Sorry. Okay, are you able to read that? I can't even see my phone. Can't see the sides. Yeah, Melissa, you're on. You're right. 1 second. Ooh. Let's see if that helps. Okay, it's a little twisted, but hopefully you can read it now. Okay, awesome, Mahad. Do you do this daily, Bishweshwar? Sorry if I'm mispronouncing your name. So far I've been doing it daily. I've been on a good track record. But it's usually I go live whenever I have time, and I've been pretty free this week, so yes. Oh, Dr. Gonwan is looking for a study partner. Okay. Okay, we got some answers. So Doug was thinking it's A. Joe Habibi is thinking a mass. What time? Honestly, it's really random. I need to find a select time I can go live. I hope to get that fixed. Date and time. Okay, we got some options coming in. Sebastian's thinking it's B. Imelda is thinking D. All right, let's read this and go through it together. Okay, Chloe's thinking A, heavy metals B, Bailey E. Okay, so we're kind of all over the place. Let's see what's going on. So again, I'm going to read the last sentence first, and then, we'll break it down. Further evaluation of this patient will most likely show which of the following. Okay, so most likely. Let's kind of figure out what's going on in this patient first. I always like to try to diagnose the patient, even if that's not what the question is asking, so at least I have an idea. Okay, a 45-year-old woman comes to the physician because of fatigue, abdominal cramps, watery diarrhea, and a weight loss of 8.8 pounds over the last 4 months. So she's a middle-aged female. She's tired. She's got cramps, watery diarrhea, and weight loss of 8.8 over the last 4 months. I kind of reread it. I know it seems redundant, but I like to talk to myself when I do questions just to summarize. And I know it seems like it's a waste of time or spending too much time, but I promise you guys, it does help to speak with yourself. So middle-aged female, and so it seems like she has like GI issues, she's diarrhea, she's losing weight, that immediately. Weight loss, that's usually unintentional. Cancer is a huge red flag that comes to my mind. Okay, and then she's tired too, pretty non-specific. She has recently avoided drinking alcohol and eating spicy food because it worsens her diarrhea and causes episodes of heart palpitations and reddening of the face and neck. So clearly when she drinks alcohol or spicy food, it makes her have heart palpitations. So we're throwing in the heart in issues, and reddening of the face and neck. So red face and neck, this is making me thinking like things like flushing or redness. So I got GI problems, I got heart problems, and I got flushing. She takes lisinopril for hypertension. That's an ACE inhibitor. Makes sense. Her temperature is 97.7, so she's afebrile. Pulse is 98. That's high. And blood pressure is 149/90. That's high. The abdomen is soft, and there is mild tenderness to palpation with no guarding or rebound. No guarding, step 2 students. You guys should know what that's ruling out. Helps in step 2, as step 1 as well. So just kind of reaffirming that there's GI problems. Lab studies show an increased urine 5-hydroxy indolacetic acid concentration, or 5-HIAA. This is our buzzword right here that we wanted. Okay. 5H, this is how it's kind of shortened, 5-HIAA, more commonly known as this. So 5-HIAA is usually the breakdown product of what substance, guys? Awesome. So Adogu's got it. So serotonin. So she has a lot of serotonin breakdown product in her urine. That's usually talking about what condition, guys? Okay, so 5-HIA, I think of serotonin metabolite. I can't spell. Serotonin, and too much, yes. Okay, so Amanzu and Dean and Mahad and Favor Adogu, yes. I'm looking at carcinoid. Okay, so she's got a carcinoid syndrome. Okay, do you guys remember there's 4 things when you see in carcinoid syndrome? They gave us a few of these. So 4 things I always think of with carcinoid. They have flushing, which they gave us. They have wheezes, which I don't think they gave us wheezing in this one. There is diarrhea, which we got in this one. And the fourth one is right heart issues, usually the valves on the right heart, in which they gave us, right, in the form of palpitations. So we got 1 of these, we got 2 of these, and we got this 3rd one. They didn't give us wheezes. They don't have to give us every single thing. Okay, and so that kind of gives it away. Okay, so what else would you see? I'm like, okay, well, I would look for things that didn't mention. So I'm like, okay, I'm gonna look for wheezes. Okay, and I'm gonna look for like some right heart issues because they only gave me palpitations. Looking at the option choices, okay, I just keep it simple. I'm looking for the lungs, a problem in the lungs, or a problem in the heart. That's supposed to be the shape of my heart. Going through this real quick, I see heart right here. This is GI, so I'm like, nope. Urine, that's like GU, kidney and urine. I'm like, I didn't say that. Adrenal, I didn't say adrenals. Chloridia, I'll hold on to it, but like that's like chloride, but I can't really match that with lungs or the heart to really simplify it. Okay. And so the only place I see the lungs or the heart is option E. So those of you guys saying option E, pulmonic valve stenosis, that is a key feature in carcinoid syndrome. They have right heart issues. Okay, it could be pulmonic valve, it could be tricuspid valve, so you don't have to like pigeonhole yourself into a specific, but I'm thinking heart. Okay, Dean changed your answer to E. All right. Okay, let's go through some of these. Let's see. Oh, somebody asked, what is option A? A, chloridia is talking about basically having let's see, like oh gosh. This is usually a hint for VIPoma, a tumor of the vasointestinal active peptide. Okay, they also cause intense watery diarrhea, like massive watery diarrhea in VIPoma, but it doesn't match every single thing else mentioned, right? So this 5-HIA is just like kind of like just locking me into carcinoid, and so you wouldn't see that there. Okay, even though they have the watery diarrhea. So it's possible, but not with this. Adrenal medullary mass. Do you know what this diagnosis is? Mass in the adrenal medulla. Thank you, Dean. Oh, okay. Oh, gosh. Thanks, guys. You're already answering the question that somebody had asked. Wonderful. Okay, yes. Adrenal medullary mass. This is talking about pheochromocytoma. What would make this a distractor is, remember, pheochromocytoma also has things revved up, right? They have increased blood pressure. They can have palpitations. So it's kind of related. But again, the 5-HIA is just locked in and rules out any other option. So this is pheochromocytoma. Okay. Purple red colored urine. Anyone know what this is a little bit tougher. Anyone know what yes, blood. So VMAs in the urine would be kind of a test to diagnose pheo. So purple red colored urine. Anyone know what that hint is for? It's pretty specific. When they say purple, because the red colored urine, you know, it's so many things, but when they say purple, another description they can say for the purple red colored is they also say port wine colored. This is pathognomonic. Port wine colored. Okay. Ooh, I think Mahad and heavy metals and Dean has got it. Yes. So this is usually talking about porphyria. Acute intermittent porphyria is what I would look for. Purple, red colored urine. Multiple peptic ulcers. Okay. So if there's a patient who has multiple ulcers, not just, you know, one or two, multiple that can go down into their jejunum even. All right. So it kind of goes down pretty far in your intestines. That's a classic hint for something. All right, I already got the answers coming in. You're thinking of Zollinger-Ellison syndrome, which is usually derived from a tumor, gastrinoma. This is how I would separate that. Yes, again, this is just for practice, but again, just to kind of beat a dead horse. 5-HIAA buildup, huge hint for carcinoid syndrome. Okay, and keep those 4 things in mind that you would see. All right. Side note, anyone remember where, nah, all right, that's fine. Actually, we already answered it. Okay, any questions on anything related to this? Dean, this is, these are step 1 questions, but it does help with step 2. This could be easily talking about step 2, but instead of asking further evaluation, they could just say, what's the test? What would you diagnose? What would be, some management options? But yes, so still pretty helpful in step 2. Carcinoid syndrome does come up. Throwback, nice. Okay, so this was another 4-hammer question, so quite difficult, but I thought was pretty a good fair question. Okay. User 865, congratulations, it's passed. Step 1 is pretty intense to study for. So when it's done, it feels really good. Anyone have step 1 coming up soon? In, let's say in the next couple of months. Okay, let me pull up another question while I talk to you guys so you guys can attempt the next one. Bailey, in 80 days. Okay, and some Ihab Jarbua in March. Dean, okay, step 3 you got finished a few months ago. That's awesome. Yes, I do think step 3 was easier than step 2. And so I do feel like step 1 is difficult for students who just hate the memorizing and like the little nitty-gritty details. It's pretty tough. Amanzu and Sarma, you have step 1 coming up. Nice. Oh no, why are you stressed? Are you in dedicated studying? I mean, it's a stressful process, so that's kind of a silly question. Okay, so this is another, I believe this is another 4-hammer. Yes, this is a 4-hammer question as well, so pretty tough, but I think a pretty good explanation. Okay, so Abdul Rahman thinks it's E, blah, you're thinking it's F. We're going to read through this in just a second. Heavy Metals thinks it's F. Okay, let's go through this. Okay, Bailey, you're thinking E. Purple Iris E. Ehab is F. Okay, it seems like a lot of us are between E and F, I believe. So let's read this again. I'm going to read the last sentence first and then circle back up to the top. The patient was most likely treated with which of the following drugs? Okay, so what drug was this patient on? That's what we got to find out. A 72-year-old man with congestive heart failure is brought to the emergency department because of chest pain, shortness of breath, dizziness, and palpitations for 30 minutes. So he's an elderly male, history of CHF, and he's having chest pain, shortness of breath, dizziness, and palpitations for 30 minutes. So it seems like there's something flaring up, maybe an exacerbation. We're not sure. But it looks like a lot of heart-related issues. An ECG shows a wide complex tachycardia with a P wave rate of 105 and R wave rate of 130 and no apparent relation between the two. Okay, so he's got EKG changes happening here. Okay, so his basically his atrial rate versus the R wave rate is really high. Okay. So there's some type of exacerbation happening. Intravenous pharmacotherapy is initiated with a drug that prolongs the QRS and QT intervals. Okay, which of the following was he probably treated with? So now there's a couple of angles. Can you put the screen sideways? I'm sorry, I'm trying to like... Oof. Are you able to read that? Sorry for the intense movement. Okay. Anyone know what the answer is? I think a lot of us are between E and F. Okay. So, again, we can use a couple of angles to answer this question. I'm going to use the fact that there is prolongation of the QRS and QT intervals. Okay. The QRS is usually representing the depolarization of the ventricles. Okay. And we depolarize the ventricles with sodium. Okay, so if it's prolonged, does it make sense that we probably blocked the sodium, which is kind of prolonging the QRS? Okay, absolutely, right? So phase 0. But the QT interval is also prolonged, okay, along with the QRS. So everything's prolonged. We're kind of slowing down like more like the ventricular side of things. Okay, so I'm going to look for something that's a sodium channel blocker in the option choices. So I'm going to get rid of E, because that's a beta blocker, and potassium channel blocker. I'm going to get rid of carvedilol, because that's a beta blocker and alpha blocker. And I'm going to get rid of verapamil, because that's a calcium channel blocker. Right away, do you see I'm only down to C, D, and E? Okay. Just to compare, like if you're looking for potassium channels, I would look for more like T wave issues, not so much QT interval. Okay, so I'm down to these three. Now, just to practice, quinidine is from a class 1A antiarrhythmic, right? Class 1 are all sodium channel blockers, but this is from class 1A. Lidocaine is from class 1B. Again, 1 is representing sodium channel blockers, but this is B. And then flecainide is from class 1C. So we have one from each category of sodium channel blockers. Do you know which ones, A, B, or C, causes the QRS to be prolonged or stretched out? That's the hint that we need to use. Okay, so for those of you guys who said F, I'm sorry, F, you'd be correct. Quinidine, which is class 1A, 1As, they stretch out the action potential, so it's longer. 1B makes it shorter, okay, so it prolongs it. B is shorter, and class 1C, it stays the same. The QRS duration. Oh, blah, yes. Oh, wait, hold on. Yes, some of them do, like procainamide has the inherent property. Dean, pacemaker. I know, I would honestly go for pace next, but, you know, they wanted a medication based on the disconnect between the atria and the ventricles, right? Okay, good. So again, you can use different angles to answer this. I use the ECG changes, so I'll figure it out. Right? Step 3 would be like next step. Yeah, again, next step in management, I'd be like, I probably want to go to that first. James Chow, quinidine is no longer indicated. That, I mean, again, it's what the exam wants versus what we do in real life, and there's such a disconnect. I could harp about this like, you know, all day. You would think the exam should represent what's clinically done. Please recap antiarrhythmics in a few seconds. Ooh, that's a tall order. User 279, it's just that the inherent properties, right? That they have an effect on phase 3 or not in the action potential. And so that changes the duration of the QRS. Storyteller flecainide is a sodium channel blocker from class 1C. Okay. You're welcome. Step 2 CK. This is step 1 question, but again, I think it really does set up really well for step 2. Okay. Let me see if I can meet the challenge of going over antiarrhythmics. Okay, so if it seems like a blur, please ignore the next couple of minutes. User 111, there you are. You know, classic user 111. Can't be happy. So antiarrhythmics, there is class 1, 2, 3, and 4. Okay, class 1 is sodium channel blocker. Class 2 is beta blockers. Class 3 is potassium channel blockers. Class 4 is calcium channel blockers, the non-dihydros. Class 1 has, oops, I messed something up. Class 1 is A, B, and C. Class 1A has quinidine, procainamide, and what am I missing? Disopyramide. Class 1B has lidocaine, phenytoin, mexilatine, and but what am I missing? Yeah, those are the 3. Class 1C has flecainide and econide. Beta blockers, we have cardioselective, which block beta 1 receptors only, and then we have non-selective, which block beta 1 and beta 2. Okay, anything, they all end in LOL. Okay, if they start from A through M, they're cardioselective, beta 1, except for C and L. And then N through Z plus C and L, so nadolol, labetalol, carvedilol, are non-selective. Potassium channel blockers, we have amiodarone, we have sotalol, which is also a beta blocker. We have dofetilide, and what am I missing? Ibutilide. Calcium channel blockers, the non-dihydros, is verapamil and diltiazem. How'd I do? Okay. Nice block. Good. User 279, this is more targeted to step 1, but again, it does help with shelf exams. I think it helps with step 2. It can even help with step 3 if you're studying for the COMLEX level 1, level 2. Okay. Anyone ready for the next question? I have another, I think, 4-hammer question coming up. Let's do it. Okay. This one is classic step 1, just nitty gritty, annoying. I don't like them, but we gotta know it type of question. This is another 4-hammer question. Let's read through it. Tell me what you guys think the answer is. And, oh, Storyteller, did you get that screenshot? I did zoom by real quick. Thanks, James. Thank you, Mohammed. Adogwu, you're welcome. Bashar, sorry. You're welcome. Okay, so let's read through this. This one we're going to break down. This is like classic, the molecular stuff, the genetic stuff, which is probably one of the things that makes step 1 so terrible. Okay, so this is a 4-hammer. If you guys think you know it, throw it in the chat. Interesting question, I know. We're going to read through this in just a second. Let me know. Let's start with, again, what do you think is going on in this patient? Even though that's not what the answer wants or the question wants, what do you think is a diagnosis? I always tell students, like, diagnose the person first, okay, if you're not really sure. Okay, we got some option choices. We got H and H and H, okay, coming up. Okay, we got some diagnoses coming in, okay. Somebody saying only high yield is saying neurofilament. Okay, so let's read through this question. Again, reading the last sentence, and let's see what this guy's got. A biopsy of the hilar mass is most likely to show cells that stain positive for which of the following? So there's a hilar mass, and what am I going to see at the cellular level, and it stains positive? So let's figure out what mass this is, and then go from there. A 70-year-old man is brought to the emergency department by his wife because of progressive confusion for the past 2 weeks. He's an elderly male, and he's confused for 2 weeks. Could be a lot of things. He also has had a 10-pound weight loss and fatigue during the last 6 months. So again, weight loss, red flags in an exam, I'm thinking cancer. Physical examination shows enlarged lymph nodes in the right axilla and faint expiratory wheezing in the right middle lung field. So he's got lymph node enlargement in the right armpit axilla, and he's got wheezes in the right lung. Okay, so it seems like a lot of stuff on the right. He is only oriented to person, so he's very confused. Serum studies show a sodium concentration of 125 and increased ADH, or antidiuretic hormone concentration. So his sodium is low. Normally it's supposed to be 135 to 145, and he's got increased ADH. An x-ray of the chest shows a right-sided hilar mass with mediastinal fullness. Let's put it together, guys. We've got a mass, okay, in the hilum. We got ADH, high, and we got low sodium. Okay, and he's had weight loss. We could throw that in there too. Mass plus weight loss makes me think cancer. Increased ADH and low sodium, even if they just gave us one. For those of you guys saying, the answer is small cell lung cancer. Okay, small cell lung cancer is the one that can have paraneoplastic syndromes, which could be ADH, it could be ACTH, it could be Lambert-Eaton. God, I forgot how basic step 1 was. Ooh, lucky you. All right, if you're finding it basic, that's amazing. Okay. So Now they say, what is it going to stain positive for? So small cell lung cancer on the histology or the cellular level, we literally have small blue cells, also called Kolchitsky cells. And what do they stain positive for? And this is where a lot of us get stumped, because even if you can reason through it, now it's like, okay, well, if you know it, you know it. If not, you could sit here all day and not know. Okay, and that's like what step one likes to do. So, guys, the small cell lung cancer is a type of neuroendocrine tumor, and the marker for neuroendocrine cells is the neuron-specific enolase. This would be the answer. So those of you guys, I saw a bunch of people say H, you'd be absolutely correct. Well done. Okay. Just for practice, let's run through some of the other ones. Okay. Out of these options, I guess the next, in no particular order, but kind of focusing more on high yield ones. Which one of these is a marker for neural crest cells? Right, Sarma? It is. This is where the memorization comes in. If you know it, you know it. If you don't, you can't really reason through these options choices, right? Which one of these options, guys, represents neural crest? Gosh, I can't talk. Neural crest cell marker. Okay, awesome. So S100 is for neural crest cells. There's a lot of tissues that are derived from neural crest cells. Some of them you want to think of like Schwann cells, so like schwannoma. Melanoma, right? Melanocytes is from here. Okay, so that would be S100. Neuroblastoma, right, would be this. Oh, thank you. From Ashgabat. Nice. Thanks, James. Appreciate it. What's another good one? Let's jump to option D. Glial fibrillary acidic protein. What is this a marker for? This is pretty high yield. Step 2 cares about this too. Glial fibrillary acidic protein, also shortened as GFAP or GFAP. Good. This is a marker for your astrocytes in the brain. Typically for like glioblastoma multiforme, right? That's derived. This is usually like stage 4 astrocyte cancer, or pilocytic astrocytoma, usually found in kids. So astrocytes is kind of the connection I'm going to make for GFAP. Another important one is tartrate-resistant acid phosphatase. There's a lot, but high yield, there's 3 cancers I want you to connect to tartrate-resistant acid phosphatase, also shortened as TRAP positive. TRAP. Which one is TRAP? Yep, blue sky. Okay, I see a couple of answers coming in, right? So tartrate-resistant acid phosphatase, TRAP positive, is hairy cell leukemia. Okay. It is also seen in malignant melanoma. Anyone know the third one I'm looking for as far as high yield? Okay. Oh, I'm so sorry. I'm so sorry. I made a mistake. It's only hairy cell leukemia. I apologize. I jumped to the genetic marker, which was the BRAF. I apologize. So it's only hairy cell leukemia, TRAP positive. I think of hair trapped in a drain. It's gross. Okay. So hairy cell trapped in a drain, it's going to make me BRAF or BARF. Right. So it's BRAF positive. Okay. I think these are some of the high yield ones. Other ones, just to kind of get that down. Vimentin is more with tumors of muscles. So, nope. Gosh, I can't. Desmin is more with muscle. Vimentin is more with mesenchyme, or like connective tissue stuff. Okay. I don't think you really need to know napsin. I have never seen a question about napsin. And then neurofilament is usually with like a neuroblastoma. Mikhail, yes, so rhabdo, right, would be like more muscle. I would look for more Desmond positive. Yep, nothing more. You got it. Did you post the cards on YouTube? No, Diamond, I did not. I need to. Yes, napsin is more with lung adenocarcinoma. I usually use the napsin to kind of separate from other cancers of the lungs, but this is usually for adenocarcinoma. Okay. Good. Any questions on this? What's the candle scent of today? It's a good question. I don't know. I just like it because it makes like those crackling sounds. It looks like I'm like in it's fir, like FIR, like the tree. John Roberts, I am not in med school. I graduated. I passed the USMLEs and now I teach. Okay, so I've been teaching for about 8 years now, and because I love teaching. I teach. I've been doing this for years and I absolutely love it. And that's why you might think I know so much, because I struggled when I was studying for the boards. And I was like, there's got to be simpler and easier ways to talk about this. And it was just really hard to get help, right? Which is kind of ironic being in the healthcare field. So I try to be, a source of support, or I try, right, for something that I struggle to get. Thanks, Imahad. Okay. Everybody ready for the next question? Okay. You guys can keep asking questions while we, get. Can you see this on the screen? Yeah. So if you, what's so advice for me? MS1. John, it's in like first year, really focus on the classes and getting your foundations right, like physiology. Blah. I love it. It's really getting your foundational knowledge down. What I've seen with students who come to me is, unfortunately, it's not their fault, but a lot of the med schools, they don't really teach well, whether you're an IMG or went to the Caribbean, or even I've seen, students from, the US, they're just not prepared well, or get the foundational knowledge. It takes a while to get the basics down. And so I like to start with the basics, get the foundational knowledge down, the physiology, so to say. And a lot of students are like, oh, wow, like I wish I knew this, in year one. And so if you are in first year, I would say get down the foundations now. Oh, thank you, Salo. Welcome from Kenya. Diamond, yeah, I know. I'm trying to get somebody to help me organize all these videos and clips and put the long form on YouTube in an organized way. So I promise I am working on it, so you guys can see it without like the disjointed clips I just throw on TikTok. Imad, your question. Oh no, I think I missed it. Thanks, Kenik from Kenya. Ooh, Imad, I'm so sorry. Let me scroll. Let me see what your question was. Is that possible to get step 1? Oh, I'm sorry. I don't think I understand your question, Imad. Hello, I'm graduate from 2 years and I have green card. Is it possible? Oh, yeah, absolutely. Why not, right? So, I see what you're saying. As far as like getting into residency and stuff, are you talking about like the kind of more like the geopolitical issues? I'm not sure. What is something I should do apart from med school schedule? Hopefully if you have UWorld or Amboss, like this question banks, it's good to start doing some practice questions, even like leisurely, to get in the headspace of understanding question formats. Okay, so let's do this question, guys, and let's see what's going on. I believe this is a 4-hammer question as well. So again, tough. And then We'll go through it. Okay, you're welcome. Ahmad, it does. You know, you need to dedicate a good amount of time here, right? You're looking at some months. You typically, especially if you're an IMG, it takes a while to relearn the foundational knowledge that, you know, is from year one. Okay, let's read this and let's figure out this one. Further evaluation is most likely to show which of the following. So further, what are we going to see? A 76-year-old woman with a history of hypertension and type 2 diabetes mellitus is brought to the emergency department 60 minutes after the acute onset of left-sided abdominal pain and nausea with vomiting. Oof. Okay, so she's an elderly female. She has high blood pressure and type 2 diabetes from before, but now for an hour, she's been having left-sided abdominal pain and nausea with vomiting. Okay. Based on like a lot of the ways, you know, I teach, you should already be thinking about something. Elderly who's having left-sided abdominal pain that's sudden. Think of something, guys. She underwent emergency surgical revascularization for acute left lower extremity ischemia 3 weeks ago. Okay, this is another hint, guys. What are they trying to tell us here? She had a revascularization surgery in her leg 3 weeks ago. And now she's having pain in her left abdomen. Physical examination shows left upper quadrant tenderness without rebound or guarding. Again, no rebound or guarding is ruling out something for us, guys. Step 2 students, what is it? Serum studies show an elevated lactate dehydrogenase level. Okay, so it's acute. Lab studies, including a complete blood count, BMP, and hepatic panel show no abnormalities, so there's nothing there. A contrast-enhanced CT scan of the abdomen shows a wedge-shaped, non-enhancing lesion in the spleen. Okay, guys, they kind of just gave us a lot of hints here. What is going on? Okay, so she's having sudden pain and nausea and a wedge-shaped lesion in the spleen. Yeah, so for those of you guys saying splenic infarction, this is telling me spleen infarction. Okay, and then 3 weeks ago she had something probably similar. She probably had like pain in her left lower extremity. Okay, so wedge shaped is something blocked it and causes ischemia. It's an embolic event. So she first had an embolus that went to her leg and caused ischemia, and she needed to get revascularized for it. Now she has another embolus that went to her spleen and is blocking the spleen and is causing pain in the left side of her abdomen. So she's throwing clots. She's throwing emboli. And what's the culprit? Who's throwing the clots? It's usually the heart. Okay? She probably has an atrial fibrillation. A classic presentation of AFib is this heart is throwing clots. It can go to the spleen, it's going to her leg, it can go to her brain, it can go to, you know, the kidneys, just these embolic events. This one happened to go to the spleen and the leg 3 weeks ago. Okay. Also, whenever you see an elderly adult who's having sudden left-sided abdominal pain, okay, they can also say like pain out of proportion to the exam findings. They did find tenderness, but there's no rebound or guarding. This is usually talking about acute mesenteric ischemia. This acute mesenteric ischemia is because an embolus flew from the heart and got stuck in her GI blood vessels. Classic old person coming with sudden abdominal pain, you know, with vomiting. She has a peripheral vascular disease, you know, she got the disease in the vessels. Anyway, what else are you going to see? We got to connect this to atrial fibrillation. Right, Blah? I agreed. Yes, Sandra. So the LDH being elevated, again, we can use this as to practice, is usually from hemolysis that's happening. Okay, so that's possible with that. Oh, well, I mean, even though her CBC was normal, right? But it's possible. It's the spleen. Anyway, so what would you see that's connecting to atrial fibrillation? Now kind of is a little bit of a matching game. AFib would have absent P waves on an EKG or ECG. Okay. Okay, good. So for those of you guys who said A, We got a few answer choices in here, right? Okay, yes. So, I mean, thank you for answering in the chat. But when you see peritonitis, dang it. If you see rebound, tenderness, or guarding, that's usually a hint for peritonitis. My step 2 and step 3 students in this chat, whenever you see signs of peritonitis, what's the next step in management? Every time. Next step in management for features of peritonitis. Yeah, right. We're going to go in XLAP. XLAP, perfect, right? So Mel Jordan, exploratory laparotomy, XLAP. Lean forward. Oh, Sandra, I don't know what you mean. Okay, why not D? It wouldn't be D for the fact that they said the right atrium. If there's a clot in the right atrium and it gets dislodged, it's probably going to go into your lungs, okay, not your systemic circulation. Oh, yeah, perfect, Blah. You got it. Okay, any questions on this one? Again, this was another 4-hammer question. You guys had to figure out that this was AFib with the presentation of having embolic events. Step 2, step 3 students, you should already know, you should also know, what medication should this woman have been on to prevent embolic events with AFib? So somebody who gets like a diagnosis of AFib, we got to analyze whether they need to be put on blood thinners. Okay, do you know what medication that she should have been on to avoid this? Nice, Mikhail. You got it. Okay, so you want to put them on a, it used to be warfarin. So warfarin is still an option. Okay, but you want to put them on a blood thinner. They usually want 10A inhibitors, direct 10A inhibitors such as rivaroxaban, apixaban. Okay, and I saw somebody say the CHADS-VASC, just me, yes. So that's the CHADS-VASC score that you analyze the need for somebody being put on rivaroxaban for AFib patients. CHADS-VASC score, I have no idea, but step 2 is obsessed with asking questions about AFib and CHADS-VASC. So I think it's really, really high yield. Yeah, absolutely, right? So you got to watch out for those issues as well, right? It is a blood thinner. Okay, let me see. Did I miss any questions? Please explain for answer A. Remember, in atrial fibrillation, there is 2 EKG changes that you look for, absent P waves and irregular RR intervals. So I would have looked for any one of those. Oh, I think maybe somebody would ask schistocytes. Yeah, you wouldn't see schistocytes because the CBC was probably normal. Okay, I would see something with like hemoglobin being low or something along those lines. That would not be the case. Okay. Okay, any questions on this one? Again, hopefully helpful. Do I have another question coming up? Ooh, I think that's the last question I had. No more questions. I thought I had more. Okay, so I guess we're going to pause here for tonight. Any other questions related to what we've talked about today or anything else in general before I sign off? Sean, I have more questions. I'm out of questions, right? I don't have anything else prepared. You're welcome, Abdulrahman. Hopefully I'll go live again and we can do more questions. You're welcome, just me. Mimi, yes, I do. But I work with each student one-on-one personally. I like to have a more of a customized plan for step 1 and step 2 students. So I do have a course, but it is specifically just for you that I help build for you. If you want more information, you can just shoot me a DM or sign up for a consult. The link is in my bio. You're welcome, Blah. Thank you. Sean, no, I do not. I'm not too comfortable with MCAT material, so I can't really take a position to teach MCATs. Do you know if accommodations are difficult to get for step one if you have a disability? I know you have to jump through a lot of hoops. I know if I'm working with a few students currently who have applied for accommodations, and they've been approved. I mean, you need like, legitimate diagnoses and letters from your specific doctors and physicians. It does require jumping through a few hoops, unfortunately. So, but I've worked with a lot of students who have had it approved, so it's not impossible. Hossam, how much time should you take for step one? It depends, what's your background and, how long do you have for dedicated? It's a very variable answer. No, Don Bupo, don't give up. Please don't, right? I've worked with so many students who have passed step one on the second attempt. I've had students and friends who passed step one, on the third or fourth attempt, and they're in residency. So please, I mean, I know it's tough, right? I don't want to sugarcoat it. It is much harder, but please, it doesn't have to be the end of the road. How many hours is ideal? If you're in dedicated, you should be putting in like good, 7 to 10 hours of quality hour studying time. Could you do some step to contact? Step to contact? Dear me, I don't think I understand your question. Could you elaborate? Oh, Mel Jordan, thank you so much. I've been doing lives pretty frequently lately. Fingers crossed I can continue. And I'm really, really glad you found that helpful. Hopefully I'll see you the next one. Nothing more. I mean, you and me both. I don't have a schedule. I'm trying to plan a schedule so you guys know when to prepare, and you can be given a heads up. I'm hoping to get that locked in. So there's a certain time and date I go live every week, but not yet. Okay. Yeah, dear me, thank you. Thank you for elaborating and explaining that a little bit better. Zora, this is from Amboss question, so you should be able to get it. Amboss gives a free trial for 5 days. You don't even have to put your credit card in. Gives you a little quick idea of what the questions look like. Oh yeah, Nabil, absolutely. I've worked with a lot of IMGs who are in the process of applying currently, or have applied, have matched. Some are even in fellowships now. So yes. Adogu, yes. I mean, ideally 10 plus hours, but I'm saying quality study time. So you take out lunch breaks, dinner breaks, and just, sitting at your desk, you could sit for 10 hours, but quality, if you narrow it down, it becomes like net 7 hours, 7-8 hours. Like just content around step 2, possibly like OB-GYN stuff. Yeah, sure. We can set that up. I can try to maybe do step 2 questions next time. We'll do nothing more. I have that board that you can join, like the channel. The link is in my bio. It's a USMLE board. That's where I make the announcements if I have enough heads up time, and I announce what time I'm going to be going live and which topic, if there's a topic. I also put polls so you guys can vote on what subjects you want to discuss in the lives. Sorry, blah, I ruined your doom scroll. I can't guarantee it. It's tough to say, dear me, but psychiatry, yes. I'm not sure about emergency. I would have to look that up further. Yep, Don Bupo, I agree. Hi, V Petals from Germany. Are you studying for step 1? Yeah, so dear me, I think it's possible. I mean, you just have to have like a much, much more competitive application, right? Just be realistic about what to prepare for, and then kill it with step 2, right? Get a really solid score. Adogu, oh, I'm so sorry. I would say try, if you haven't done like NBMEs, I hate suggesting NBMEs as a source of studying because they're the bane of my existence, but they have helped students who are preparing for the CBSE. It helps with like those out-of-pocket questions CBSE likes to ask. V Petals, yes, I do. Okay, you can shoot me a DM and I can share more information. And also, or you can sign up with like a free consult with me if you want like a meeting with me one-on-one. That link to sign up for a meeting with me is in my bio. It's free of charge. You just talk to me and I can explain things and go from there. congratulations, V Petals, on graduating. I know Don Bupo. I know a lot of students I work with ADHD. One student, well, actually a few, they have learning specialists from their school. And I've, trying to find like creative ways to help with ADHD prep. It does have a toll of kind of finessing how to study. Adogu 2130. Oh, yeah. So start with those first, the NBMEs, and then depending on if your score is still not where you need it to be, then even the older ones, work your way backwards numerically. Hossam, I just started internship. Will I be able to finish step 1 and step 2 within these years? How many years I'm assuming internship is like 2 years? Oh, please do, V Petals. I'd love to hear from ya. I love talking to students, even just, if you want to pick my brain about anything, happy to talk. Zora, how to study? I would say definitely start with practice questions. A lot of people keep their practice questions towards the end. Start incorporating it in your daily prep. I can't stress that enough. And then videos for micro, internal medicine, and immunology. Are you starting for step 2? Or are you talking about step 1? Micro, a lot of the popular ones is like sketchy micro. A lot of students like if you're a visual learner. I have some videos too. If you are interested, I can share some samples. I have like a video library of a lot of these subjects focused on high yield. Nice, Blah. Thanks for sharing. Oh, nice, Adogu. That's helping. Okay, that's awesome. Yeah, I also like to read out loud. I don't know if that helps. I like to speak audibly. I hear myself, and I also pace. I like pace in my hallway or outside. I go for a walk, kind of gets the blood flowing, and also reading out loud. It sounds really silly, but even when you're doing questions, read out loud audibly, right? You can hear yourself. Honestly, it sounds silly, but when you hear what you're saying to yourself, it helps you keep the information organized, especially with those longer vignettes. Nabil, do you get a lot of people that are able to pass step 1 without Anki? Yes, me. I never used Anki. So yes, I also have worked with students who don't like Anki or just don't get like the hang of it and they can't connect with it. So yes, absolutely. There are other ways around it. Again, all these study sources are so popular, they do work. You just got to find what works for you and commit to it and stick to it. Okay. Don't try to do all the resources and spread yourself out too thin. It actually ends up hurting you more than helping. Nice, Blah. I'm glad that helps. You do feel crazy. Sure, Zora, if you just send me a DM, I can send you like a sample or two just to be very like transparent. This is my work. This is what I do. So I do sell the videos for purchase. But I know you don't want to commit to something that you have no idea about. So I do share a couple of samples of my videos. And so if you send me a DM, I can share those videos. And if it's something that you like, then of course we can move forward from that. Yeah, Anki, a lot of students don't like the platform or the way the cards are. So I think that's totally fine. Okay, guys, I think if there's any other questions, what sources? Oh, she's asking Don Bupo. Okay, guys, if there's no questions, I'm going to sign off. It's almost 1 a.m. here. I need to get some sleep. Oh, Adobu, you're welcome, Blah. It's always great seeing you. Have a great evening. Adobu, what's your question? Nabil, what are some alternatives to Anki then that you can recommend? I mean, direct alternatives of Anki, it's hard to say because it is like flashcards. But just general resources I liked that I used was first aid, even though it's a hard read, but a lot of the memorization stuff like pharmacology, anatomy, micro, pathology I used from first aid. Okay, Sketchy is also a popular one. Again, I personally haven't used Sketchy, but a lot of people like it. It helps with memorizing too, with like memory hooks. Okay. What about the subject MBMEs for Path and Micro? They're pretty good. Oh, yes, for CBSE, yes, I include those MBMEs as well, to review. Oh, you hate Sketchy? I mean, yeah, I personally haven't used it either. If you want my notes on Micro and Farm, shoot me a DM. I can share a sample of it. I think what really gets annoying with like Sketchy sometimes, it's great, right? But the pictures, trying to understand and memorize the pictures is like an extra thing to memorize and just ends up being too much. And then it kind of becomes counterintuitive. The way I like to teach Micro and Farm to my students is just stripped down to just like the pure high yield, and I cut out all the fluff. Will some of that fluff come in questions sometimes? Maybe. But again, I want to make sure you get down the highest of the high yield first and then fill in the gaps if you need it. Yes, it would. In my experience, it would help as well. But I would say start with the general forms first, right? 21 to 30. Miss Koima, I did use Pathoma. I first got it and I read through all of it with the videos, but when I was in dedicated studying, I never used Pathoma. So I'm not sure if I remembered anything from Pathoma. So I don't like to say it's like important, you need to do it. It's very popular that you like to do those first 3 or 4 chapters in Pathoma, but even that I didn't do and I was fine. Again, just to reiterate, like all these sources are popular for a reason. If you don't connect with it, it's not necessary you need to do it. Just make sure you cover that, topic from somewhere. Okay, but I think first aid is sufficient. I would say, if you're using first aid, use that to study, take your NBMEs, your assessments, and if your pathology score is still not where you want it to be, then go to Pathoma, right, to increase it, but you don't need to do it all together. Okay. You're welcome. All right, guys. As always, this was really fun. I hope you learned a thing or two. I hope to go live again. It is the holiday seasons. My family's coming into town tomorrow, so I might not be able to go live for the next couple of days. But I hope to see you live next time. Join the board, the USMLE board channel thing. The link is in my bio if you want updates on the next time I go live. Okay. Yep. Happy holidays, guys. I hope to see ya and talk to you soon. Zora, how to find high yield material from lectures. Zora, if you want to shoot me a DM, I'm happy to explain that better in person. Not in person, but via chat, Okay. Have a great night or morning, guys, depending on where you're at. And happy holidays. Bye-bye.